pharmacist is a health professional that explains prescription medication to consumers and gives advice about diet or medical conditions as it relates to prescription medicines. A candidate must be interested in science, must be detailed-oriented, and have good communication skills. I had a chance to speak with Dr. Adam Czeponis about his career as a pharmacist. I am sitting here with Dr. Adam Czeponis, who is a pharmacist at the Concept Medical Pharmacy in Ashland. So, Mr. Czeponis, what made you interested in the field of pharmacy?
Well, I really had an interest in chemistry in high school and sciences in general, and actually the pharmacy part was easy. It was helping my grandparents with their medications on a daily basis. They used to have the med planners, and I'd go over and put all of their medicines in for them, make sure that they took them right. And probably by my senior year in high school, the profession of pharmacy really started taking off, so I started looking more steadily into it and just went into pharmacy school.
Which classes in high school would benefit students interested in pharmacy?
The most beneficial classes would be as high in chemistry as you can go. In college, the highest chemistry class you have is biochemistry, and go as far into math as you can. Basically, on a daily basis, we use anywhere from basic algebra skills all the way through calculus to help dose medications, figure out how medications are going to work in a body and things like that.
What education is needed to be a pharmacist, and where did you go to college?
I attended Wilkes University. Pharmacy programs are a 6-year program. You graduate with a doctorate in pharmacy degree, and it is just a one straight track through. Basically, they pick all of your classes for you. It's all laid out. You just have to, the only choices you have are your general education classes, your histories and art, things like that, before you actually get into the pharmacy school. Basically, it's 2 years of undergraduate work and then 4 years of actual pharmacy school. And they have it all laid out for you.
Are there different types of pharmacists, and if so, could you give an example?
Sure. There's many different types of pharmacists. Myself, the pharmacy I work at, we take care of people who live in nursing homes, hospitals, things like that. I do a lot of home infusion, which is if you're sick, we can make actual IV antibiotics and send them right to your house so you don't have to stay in a hospital. But the more typical pharmacists that people are more familiar with are ones who work at CVS and Rite Aid, places like that. My wife actually works at the CVS in Mount Carmel. She chose to work it, and that's considered a retail pharmacist job. And the pharmacist position where I work is considered a closed shop pharmacy, is what we go by.
What is a typical day like on the job?
Typical days, pretty hectic. Phones ring all the time, a lot of med orders, a lot of doctor calls, things like that. The only difference where I work is we don't actually have customers come to pick up medications. We deliver everything out into the community setting. So it's busy, but it's fun. Day goes fast.
Is there anything else you would like to share with us?
The field of pharmacy is rapidly evolving. There are many types of pharmacy jobs available. Right now it's more competitive to get into pharmacy school than ever before. I know Wilkes University has 65 actual seats in their pharmacy program, of which they may get in between 300 and 500 applicants every year to try to get into that program, so it's highly competitive. One piece of advice is if you want to work in an urban setting, to make yourself more marketable, it's helpful to have probably a second language skill, most likely Spanish, things like that. Companies would be more apt to hire you if you can actually have a fluent, speaking of the Spanish language.
Well, thank you for taking the time and talking with us for those interested in pharmacy.
Oh, you're quite welcome. My pleasure.
According to the 2011 Bureau of Labor Statistics, the average salary of a pharmacist is $114,000, or about $55 per hour. With a longer life expectancy and new medical breakthroughs, this field is highly competitive and expected to grow through the year 2020. If you are interested in pharmacy, the new organic chemistry class is probably a good fit for this and other medical-related careers. Stop in the guidance office for more scheduling information.